All right, hello everyone. Still about a minute or two away from starting. Just wanted to do a quick sound check. Those of you who are on computers, if you can let me know if you can hear me, just give me a thumbs up or send me a little chat. Let me know that you can hear me. Testing, testing. Anybody out there? Got a thumbs up. Okay, got one thumbs up. Thumbs up. All right. It's got a couple people commenting in, so I guess you can hear me, which is great. Good, perfect. All right, so 6:30 on the dot. We got a few people signed in. Pretty good. We got a couple people calling in on the phone, so I'm going to try to verbalize some of my slides as best I can for those of you who can't see the slideshow. And let's get started. So welcome. This is a encore presentation. I did this webinar about a week and a half ago, and we had amazing feedback. Quite a few people tuned in to watch it. And so we decided to do it again to help spread some information and knowledge out there to help decrease some of the fear and the panic and hysteria that's going on. Because there's a lot of misinformation out there. So my name is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center in San Jose, California. I am a functional medicine and integrative-based health center. Work a lot with people who have autoimmune diseases, traumatic brain injuries, and things like that. Let's get into it. So because I tend to work with a lot of people who suffer from autoimmune issues, those are often people who are immune suppressed, immune compromised, or have overactive immune systems. And so evaluating their immune system through blood testing becomes very important, and it's something we do regularly because many autoimmune patients do suffer from chronic either bacterial or viral infections that contribute to their autoimmune flare-ups. And inflammation is one of the big underlying risk factors that triggers symptoms associated with autoimmune issues. In case you get cut off or in case you want to see the longer version of this presentation, you can subscribe to my YouTube channel, Bay Area Health and Wellness Center. You'll see the 90 plus minute version of this presentation. We're going to try to keep this one to less than an hour for you guys, but you can always go to my YouTube channel and check out the lengthy version. So like I said before, created this informational piece webinar to decrease some of the panic, fear, and anxiety that's out there, teach you how to be proactive about your own health, and to support your immune system if you do end up contracting some kind of sickness, viral, bacterial, how to strengthen your immune system specifically against viral infections, and how to use nutraceuticals or supplements to support your immune system, because we're going to talk about in a little bit, to be realistic, it's only a matter of time before the next pandemic or the next epidemic hits, and there's another spread of some sort of viral bacterial infection. And waiting around in panic for a Bill Gates to create the next vaccine really a solution to the problem. It doesn't address the underlying root cause of why so many people end up getting sick and why we keep having these epidemics or pandemics. So I hope to address some of that in this presentation. If there's any doctors signed in, last time I had quite a few doctors who tuned in. These are some of the most influential teachers and researchers, clinicians I've had in my career. You can check out their information if you want to learn more about how the immune system works and how you can influence and improve the immune system through nutrition and supplement and lifestyle medicine. Quick disclaimer before we get started. All this information is meant for educational purposes only and not intended as medical advice. Always consult with your doctor before starting any supplement or nutritional program. So I'm going to be offering a free consultation virtually, one-on-one. So you're going to want to write this number down. The number is 408-752-5453. And all you're going to do is text the word immune, that's IMMUNE, immune, to that number. Again, 408-752-5453. So you can get access to my calendar and schedule your free consultation if you decide to move forward with and you enjoy the information I give you. So let's talk a little bit about the history of the world and at least in the United States, even of epidemics and pandemics. Novel coronaviruses are nothing new. SARS came on the scene in 2002, 2003, which was a novel coronavirus. Total of 8,000 cases at that time and had a death rate of 9.6%. MERS, another novel coronavirus, came on the scene in 2012, and again, another flare up in 2015 with a total case number of about 2,500 and a high death rate of 34%. And then we have 2019 novel coronavirus with right now an estimated death rate of about 2%. I think it's gone up to about 3%, but we don't really know how many people are truly infected or have been infected and recovered already, because 90+% of people who do get sick have minor to no symptoms that never require hospitalization or even contact with the doctor, so they never get tested. So in a few years, when all that data finally gets collected, I predict, and this is just my opinion, but I predict the death rate is going to be much lower, maybe even less than 0.1% like the seasonal flu is, but that's yet to be found out. And again, that information won't be published until 4 or 5 years from now. But if we look at the last really big pandemic we had, was really the H1N1 swine flu in 2009 that ended up having only a death rate of 0.02%, even less than the seasonal flu, yet it was considered a big pandemic. If we look deeper into the numbers of the H1N1 in 2009, estimated total cases just in the United States was about anywhere from between 40 to 88 million people infected. That led to a total death rate of anywhere from 8,700 to 18,000. That's kind of their estimate range. So a lot of people. And if we dig deeper into the H1N1, the last really catastrophic pandemic we had was the 1918 Spanish flu pandemic, which was a variation of the H1N1 virus also, which ended up with 50 million deaths worldwide and 675,000 just in the United States. What's interesting, if you look into the history of the 1918 Spanish flu pandemic, was that this was the last time social isolation, quarantine, shelter at home was used to try to slow and stop the spread of the virus. And what it ended up happening is the initial quarantine did lower the curve, did flatten the curve. And then when the quarantine was lifted, there was a second spike in infections that was more detrimental than the first one. Again, people were quarantined, the curve flattened out, they were released, and then a third wave of infection happened. So it's interesting that 100 years later, the most powerful country in the world with the most resources is using an 100-year-old tactic that didn't, in my opinion, seem to work the first time to try to control the spread of this virus. But we'll see what ends up happening. And this, I included this article here because this kind of takes us full circle to where we are now. A full economic shutdown, quarantine of everyone in the United States. And this New York Times article really explained pretty well why and how we ended up in this situation. And it goes on to explain how the CDC, right, the organization who's giving us all our, how should I put it, telling us what to do to control this, failed multiple times. And it started initially with other countries offering aid in the form of test kits to the United States to test people who were infected or or suspected of being infected, and the CDC didn't want them. The CDC wanted to make their own test kits, produce their own test kits, and they had a ban on private labs in the United States creating their own test kits to help with the supply. And that ban was just lifted at the beginning of March after the CDC failed their first attempt to create their own test kit, which ended up having a lot of false negatives. And then when they discovered that they weren't going to be able to keep up with the demand, lifted the ban so that private labs could then start creating their own test kits to supply, to test, and provide to public health and hospitals. So that was a huge mess up, and it really highlights the countries that did handle this situation very well and were able to stop the spread of the virus initially very quickly, and still today have minimal cases and are keeping most people out of the hospitals. The way they did that was aggressive testing right at the beginning, and basically mobilizing the entire country and independent labs to create test kits to have ready to test. And this is where the United States really failed and has led us to the situation where we're at now. So let's talk about what we know. So that New York Times piece is the only real opinion or investigative piece I included in this presentation. Everything else is pretty dry, boring research, because I choose not to look at the media for my information. I went straight to the research that's coming out, and this is what I'm going to present to you. So I'm going to summarize these for time's sake. I'm going to summarize these studies here that look at COVID-19, viral transmission, diagnosis rates, and treatments available. This is another study I'm going to summarize for you that looked at 82 deaths of COVID-19 and what they found in these individuals. And this one as well that looked at 112 cardiovascular disease patients who ended up getting infected with COVID-19. And basically what we found from those three studies was that things we already knew: it's highly infectious, especially during the asymptomatic phases, which can basically the incubation period, which can be between 2 and 14 days, which is different from other coronaviruses that don't typically have such a long incubation period and usually only spread when someone's already symptomatic. So that was a big surprise and making it difficult to manage currently. Signs and symptoms: fever, cough, diarrhea, and myalgia or muscle pain, body pain, and aches. We also found out from those studies that 80% of those infected were over the age of 60. And blood tests in these individuals, when they were admitted to the hospital, showed very high levels of inflammation. This inflammation is being referred to in research as a cytokine storm. And the cytokine storm basically is describing this massive influx of inflammation as a result of the infection that eventually is causing massive organ damage. Right? We're going to expand a little bit more on that. The other things we found in those three studies were that 77% of the people infected had comorbidities. So they had either cardiovascular disease, diabetes, they had hypertension, they had cancer. We also found out that those overweight or obese had worse outcomes. And they looked at basically BMI, which looks at height and weight ratios, to identify how much fat a person has. And those with higher BMIs or more overweight and less muscle mass had the worst outcomes by far. And the leading cause of death of all those infected with COVID-19 is respiratory failure due to the cytokine storm. This respiratory failure is being called ARDS, or acute respiratory distress syndrome. So this is by far the leading cause of death from the cytokine storm. So the question becomes, or I get a lot of questions about, well, we're hearing about a lot of younger people under the age of 60 getting sick, getting infected, and having poor outcomes. Why is this happening if it's really only, if the data is showing, or in other countries even, it's showing that it's in older people, it's affecting more older people? Well, I would say, one, vaping and e-cigarettes prior to this outbreak of COVID-19 We had a public health issue of lung injury associated with the use of vaping and e-cigarettes. That's definitely one big contributor because that is direct inflammation to the lining of the lungs, which is by far the biggest organ system being affected by the COVID-19 infection. But really, if we look at the overall health of Americans, would you expect health of Americans to be good? Are Americans overall healthy or unhealthy? Well, this research paper here coming out of the American Journal of Medicine suggests um, the health of Americans is deteriorating and deteriorating exponentially. To summarize this paper, 48% of Americans have a chronic disease today in 2020. That's half the population has a chronic disease. 81 million have multiple chronic diseases. And remember, these chronic diseases are diseases of inflammation. They are largely the comorbidities causing worse outcomes in people being affected by COVID-19. And most of these chronic diseases are diseases of poor lifestyle, either poor lifestyle choice in your diet, your nutrition, lack of exercise, your choice to smoke, your choice to drink. And so it's getting exponentially worse in the United States. 7 out of 10 deaths in the United States are due to these chronic diseases already without having an extra viral infection on top of it. Okay, so this is another big reason why so many people in the United States are getting sick. So this is a summary here, basically of those underlying conditions and the comorbidities, those with heart disease, immunosuppressed or immune compromised, diabetics, smokers and vapors, those with high blood pressure or vascular issues, and cancer. Okay, that's the summary of everything that was found in the previous studies that I highlighted. So let's get into the basics. I'm going to get into some research as far as the immune system and nutrition and how you can influence the immune system. But before I can get into that, I need you to understand the basics around that. Okay, so let's explain that a little bit. First thing you need to know is coronaviruses have been around a long, long time. This is a screenshot out of a microbiology medical textbook from the 90s, from the early 90s, describing coronaviruses. I'm going to summarize it here for you on the right. Coronaviruses pretty much create symptoms pretty similar to the common cold. Transmission is via airborne droplets, hence all the masks and covering of the mouth. And essentially what happens is the virus travels through saliva. If it comes into contact with your nasal mucous membranes, so your mucous membranes through the mouth, through the nose, or you touch a surface that has the virus and then you touch your own face, it spreads, gets into the mouth, into the nose, and then invades the mucous membranes, which is where it replicates. And this tissue, this layer of skin that lines the inside of the nose and the back of the throat and the upper respiratory tract is called epithelial tissue. This is epithelial skin, let's say. And that's where it replicates, largely in the nasopharynx, which is the part of the way back in the nose where the nose and the throat kind of meet back there. That is the nasopharynx. So that's why the current test is a nasal swab, right? They put a long Q-tip all the way deep into the back of the nose and take a sample, and that's how they confirm whether someone has corona or not. And that's because that's where it lives and that's where it replicates. And in normal immune response is when the virus touches that epithelial tissue, the immune system recognizes it. It sends out these antibodies to attack the virus to slow and stop its replication in that local tissue, and then eventually kills it before it spreads, before it continues to replicate and spread to other organ tissues. Okay, that's normal progression of immune system and growth of the coronavirus. Let's talk about basic immunology here. I mentioned epithelial tissue. Remember, it's the lining found in the inner surface of cavities of internal organs or the back of the nose. For this presentation, we're really focusing on the nose, back of the nose, the mouth and the throat, the upper respiratory tract, the lungs, and the intestines. And we're worried about the intestines because there's latest research showing that the virus can actually continue to shed and replicate in the intestines and still infect other people through stool contamination. This is weeks after the infection actually goes away. So symptoms are gone, you get released from the hospital, you can still shed the virus in stool, again, weeks after. So this epithelial tissue is essentially our barrier system to the outside world. It is the first line of defense to invading pathogens, whether they be viral or bacterial. If you think about the digestive tract, we eat food, but from our mouth all the way to the end of our intestines and the colon, it is one long tube that separates food from the outside world from our bloodstream. Okay, the intestines are what not break down, but the intestines absorb the nutrients that we need from those foods and allow them into the bloodstream. Okay, that food doesn't get direct contact to our bloodstream. The epithelial tissues of the mucous membranes do the same thing. Now, the immune system has two arms, two basic arms. The first arm is called the innate immune response. This is the first line of defense against pathogens. It consists of physical, chemical, and cellular defenses. Its purpose is to immediately prevent the spread and movement of foreign pathogens throughout the body. Okay, that is our epithelial tissue, our border system to the outside world, our first line of defense. It is also called in research Th1 immune response. So innate immune response, Th1 immune response, first line of defense. The second arm of the immune system is the adaptive immune response. This is the second line of defense against pathogens. It's also referred to acquired immunity or specific immunity. It is specific only to the pathogen presented, and it is designed to attack non-self pathogens but can make errors and attack itself. So when it makes errors or when the adaptive immune response is too high or too dominant, it starts to attack our own body, our own tissues. This is considered an autoimmune disease. The adaptive immune response is also referred to the Th2 immune response. Now, there should always be a perfect balance between both arms of the immune system, the Th1 and Th2. When one is high, the other is low. When the other is high, it suppresses the other. So there should be always a perfect balance between the two. Now, this graph here pretty much describes the same thing. We have the innate immune response. It is our first line of defense. It is immediate, right? As soon as the virus or bacteria touches our mucous membranes and our epithelial tissues, the innate Th1 immune response kicks in to try to attack it and minimize its spread. It is examples of where it's found: skin, hair, cough, mucous membranes, like we just talked about. And then the adaptive immune response, the Th2 immune response, is our second line of defense. It doesn't become active until after 96 hours of infection. And it is really a delayed response. Really, we want to focus on this innate first line of defense immune response to slow and stop the spread of infection. Let's expand a little bit more on that. Initial inflammatory response is necessary to mobilize the immune system in response to damaged tissue and to fight infection. Okay, so it is normal for us to become inflamed with a new pathogen, with a new infection that hits us, but that inflammation should subside. A prolonged inflammatory response is not good. And this is essentially what's happening with these individuals who have comorbidities. They're already walking around in a state of heightened inflammation. Then they get an infection and their immune system spikes their inflammatory load and they cannot handle it And the first thing that gets destroyed is the lungs, or the lining epithelial tissue of the lungs, resulting in ARDS, acute respiratory distress syndrome. So one of the strategies we're going to talk about is managing your baseline inflammatory load, which is what we do for all of our autoimmune patients that come here. So let's talk about this here. I got a lot of questions last time about, there's some news information going around about, well, we shouldn't take ibuprofen, you shouldn't take Advil to lower a fever because it's making the virus worse. The official CDC stance on that is none, that there's no evidence to suggest that. But the research shows that a mild fever is normal. A mild fever actually helps the immune system fight the infection. When you start to run a low-grade fever and you suppress it with Tylenol or Advil or ibuprofen or whatever it may be, you're inhibiting the immune system's natural response to fight infection. And this paper outlines that very well. So I would argue that you should watch closely the fever, try to manage it. If it gets out of hand, then of course you do use medications as needed. But if you can manage low-grade fever, it's a very necessary immune response to fight infection, right? So summary of what we're going to talk about next is how to strengthen your immune system and how to do that right now. So these are the 4 basic steps you need to know. You need to minimize baseline inflammation levels. We just talked about how people who have comorbidities are walking around already with a heightened baseline inflammatory load. That infection tips it over the edge and they have very poor outcomes. 2, you want to strengthen the barrier systems, right? We talked about the mucous membranes and the epithelial tissues. That epithelial tissue can become damaged and become porous like a cheesecloth. We need to make sure that that system is strong and robust to have a proper immune response. And we're really focusing on barrier systems, mucous membranes, the lungs, the upper respiratory tract, and the digestive tract, the intestinal lining. Number 3 is you want to have an adequate Th1 innate immune response to kill pathogens at first contact, right? That little sore throat that you feel at the very beginning of a cold or a flu, that's when the Th1 immune response should be ramping up and kicking in and stopping the replication of that virus. And I'm going to talk to you how you can do that with natural supplements. And then lastly, you want to manage the inflammatory cytokine storm. Remember, this cytokine storm is this massive inflammatory load that happens as a result of the COVID-19 infection. And I'm going to talk about supplements that actually help manage that as well. So this paper here, potential interventions for novel coronaviruses in China, a systemic review. Systemic reviews basically look at multiple studies that have been published and summarize the best ones. They weed out the worst ones, and they basically talk about what they've discovered in that summary. And you can see to the right here, all the supplements listed that have been shown to target different types of virus or bacterial infections. We have vitamin A listed here, B vitamins, vitamin C, vitamin D, vitamin E, omega-3 fish oils, selenium, zinc, and iron. It goes on to talk about some pharmaceutical interventions, which we're not going to talk about. We're focused on the natural stuff because this is what you have access to at home. This is what you can proactively do on your own year-round to strengthen your immune system. And this is really going to be addressing the root of health issues. Having a strong, robust immune system, minimizing comorbidities, lowering inflammation rates. Because like I said earlier, it's only a matter of time before the next pandemic or the next viral outbreak happens. And sitting around and waiting 8 to 12 months for Bill Gates to fund a new vaccine isn't a realistic solution, right? So let's talk about minimizing inflammation levels. First thing I recommend, mostly to the patients I work with, is having a comprehensive blood screen quarterly, okay, to track your progress. Now, interestingly enough, what I didn't mention in the earlier studies that was looking at the COVID-19 infected patients and the ones that died, was they recommend when a patient comes in doing a very comprehensive inflammation blood test panel. I can tell you in the United States, most primary care doctors do not run those inflammatory tests in a blood screen. If you go for your yearly physical, they are not testing those things. There's many reasons for that, which I won't get into, but those inflammation markers are something we always screen for in my office because, like I said earlier, we're working with autoimmune patients, their immune system's compromised. The way we address that is by identifying sources of inflammation and minimizing those. And that's how they minimize symptoms for the rest of their life. So that's something we always screen for in our office. The only time primary care doctors here are ordering tests like that is if you've already been diagnosed with an autoimmune disease, or you've had a stroke, or you've already had a heart attack. That's the only time they order those tests. I'll give you a quick story. About 2 years ago, I started running blood tests on my family just for health purposes. My dad, who at the time was either 64, 65 years old, always got his yearly physicals. He was told he was in great shape. Blood tests would always come back impeccable, normal, no problems. Well, I ran a blood test and I included these inflammatory markers, and one of his inflammatory markers was 5 times higher than the normal. So this is a perfect example of these people who are walking around supposedly healthy with no comorbidities, but their baseline inflammation levels are off the charts. They just never been screened. And then they get an infection, a COVID-19 infection, and they have terrible, poor outcomes. And that's what you're hearing all over the news. At least this is what I suspect. We won't know for sure. The other big thing you want to do is minimize as far as minimizing inflammation levels is identifying food sensitivities and minimizing inflammatory foods in general. So this is a very detailed 5-week long process I do with my patients, but the common high inflammation and high allergen foods by far are wheat, soy, and dairy. Okay, by far the most common that exists. So if you eat a meal and you feel bloated, or you get acid reflux, or you get gas or constipation, you're eating something that's influencing your immune system in a negative way. And you need to identify what that is and cut it out. Okay, there's also blood tests that can do this. We do it through a 5-week elimination program where we put people on a pretty low inflammation diet. They cut out all the high inflammatory foods for 5 weeks, and they reintroduce it one at a time to find out what triggers symptoms for them and what doesn't. And then we have the basics: avoid consumption of sweets, excess sugar, refined carbohydrates, and packaged processed foods. Um, Avoiding toxic or hysterical people. This is a big one that I had to do myself when the quarantine first started, because there were so many group chats and message groups that I was in with family and friends, and the hysteria and the panic that was growing in those groups was feeding my own anxiety and my own stress. And by far the best thing I could do, and the news can do this too, I'm watching too much of the news. So by far the best thing I did was actually block those group chats and do my own research and do my own investigating. That's what led me to creating this presentation for you all. Exercise, right? We talked about BMI and fat having worse outcomes in patients affected with COVID-19. Exercise is going to be vitally important, especially right now that we're all in quarantine and have trouble going places. So you need to be active in exercising at home. And then sleeping regular hours. Sleep is vitally important. Sleep and melatonin, which is your sleep hormone, increase your Th1 innate immune response. So sleep and sleeping at night is very beneficial for immune system function. Strengthening barrier systems, right? And again, we're focusing mostly on the nose, throat, upper respiratory tract, lungs, and the digestive tract. Let's talk about how we're going to do that, how we're going to strengthen barrier systems. So I'm going to summarize here quickly about 17 different papers, research papers. And I'm going to fly through these pretty quick. Everyone's going to get a recording of this webinar. If you're really interested in looking up these research papers and reading them for yourself, what you can do is you can watch the recording, And you can pause it every time I show one of these research studies, and you can go onto PubMed or Google Scholar, the title and the year of the publication, and you'll find this paper. Okay, so there's one, here's two, here's three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and 17. All right, so 17 different research papers, all saying essentially the same thing. I'm going to summarize those 17 research papers for you right here. Basically, the gut microbiome, which is the good, healthy bacteria in our intestinal tract, decreases systemic inflammation and improves our immune system. It improves resilience of the immune system. How we influence the microbiome of the digestive tract? Well, by the foods we eat, the foods that we expose to our intestinal tract. Okay, so that's why eliminating high inflammatory foods, processed sugars, processed carbohydrates, packaged foods is very important to a healthy gut microbiome. Elderly people have decreased diversity of the microbiome, which puts them at higher risk of pneumonia and infections. The standard American diet, right? The SAD diet, standard American diet, damages and destroys the gut microbiome, making us more susceptible to infections and pneumonia, and suppresses our immune system. The gut microbiome also protects against diabetes risk and insulin resistance, which is one of the other studies that I had in there. Vitamin A and D strengthen the epithelium. Remember, the epithelium is this internal lining of the nose, the back of the throat, inside the mouth, and the intestinal wall. Strengthens the epithelium and the mucous membranes and the immune response to fight viral infections. And on top of that, vitamin A and D are also anti-inflammatory. Remember, the cytokine storm, this huge inflammatory load that causes damage inside the lungs, can be minimized with the anti-inflammatory diet. Zinc decreases inflammation and stops viral replication, decreases risk of infection in elderly, and protects against cardiovascular disease. Okay, so zinc is another big supplement vitamin you can use to stop viral implication, decrease inflammation, and it has been shown, especially in the elderly, to protect against cardiovascular disease and lower inflammation. N-acetylcysteine, NAC stands for N-acetylcysteine. It is a precursor to glutathione. Both of these are two separate supplements you can use. It has been shown to decrease the oxidative stress and the inflammatory damage in the lungs that causes ARDS. So that's another very important supplement that can be taken to improve outcomes or lessen severity of infection, especially the COVID-19 infection that damages the linings of the lungs. And then not lastly, but the next thing we want to do is activate the Th1 immune response. Remember, we want to have a very strong, active immune response at first contact of our epithelial tissues, when that virus first touches our epithelial mucous membranes. That's going to help minimize viral replication locally, right? Locally in the back of the throat or in the nasal pharynx, so it doesn't replicate and spread as aggressively. And we're going to do that with, well, I have a series of studies here for you, which I'm going to summarize. Got 1, 2, 3, 4, 5, 6, 7. Okay, so 7 more studies I'm going to summarize here for you. The use of resveratrol and quercetin, both supplements available over the counter, have been shown to decrease inflammatory damage due to viral infections. Okay, now these two specifically were studied in the brain, and brain cells being infected with herpes simplex virus type 1, HSV type 1, and improved and limited damage from that infection, that viral infection in the brain. The use of echinacea and ashwagandha and bacopa, other herbal remedies, have been shown in the research that I just skimmed through to modulate the Th1 and Th2 immune response. And modulate basically means bring Th1 and Th2 better into balance. Because remember, they have an inverse relationship. When one is high, the other gets suppressed. Through the course of the infection, it should flip flop and Th2 becomes more dominant and Th1 starts to suppress. But if we ever get stuck in a Th2 dominance, we end up with self damage from the immune system known as autoimmune disease. So echinacea, ashwagandha, bacopa have been shown to modulate and improve balance in the immune system. Ginger has been shown to suppress Th2 immune response. Mushrooms, even like cordyceps and shiitake and maitake and reishi mushrooms, have been shown to increase the Th1 innate immune response. And melatonin increases the Th1 immune response and decreases inflammation induced by a ventilator. So remember, ARDS, acute respiratory distress syndrome, number one cause of death from those infected with COVID-19. But being put on a ventilator creates its own inflammation in the lungs, which adds to the inflammatory load that patients are already experiencing. This study itself was a study in rats, but it showed that rats put on a ventilator who were taking melatonin had improved outcomes and less inflammation. Right? And you can skim through that study if you desire later. Now, the last thing we want to do is manage the inflammatory storm. Remember, the biggest killer is this cytokine inflammatory storm that happens towards the end as this infection runs its course. How we do that? Well, we got a study right here that looks at a number of different supplements like curcumin, which is the active ingredient in turmeric, capsaicin, omega-3 fish oils. We're going to skim through this a little bit because I'm going to summarize it for you at the end. Here's two other studies looking at black seed oil and camu camu. Camu camu, specifically a root or fruit found in South America in the Andes. Antioxidant and anti-inflammatory properties, and this is pretty well documented. Journal of Cardiology actually studied and documented the use of camu camu for oxidative stress and free radical damage, which again, this inflammatory load causes massive free radical damage, oxidative stress, which destroys the internal lining of the lungs, leading to death. Black seed oil, I didn't spend too much time doing the research on it, but black seed oil is also a Th1 innate immune response supplement. You can see here in the third line down, you can see NK cells, natural killer cells, are a result of an increased innate immune response, your Th1 immune response. Okay, so let's review everything and then we'll have some time for questions. We want to have strong barrier systems, right? Strong mucous membranes. But before that, we want to assess baseline inflammatory load, right? We want to make sure that from day to day, we are not already walking around with high inflammation in our system, because that's going to cause very poor outcomes when we do become infected with something. Secondly, we want to make sure we have very strong barrier systems and very efficient immune responses in our mucous membranes. We do that with the use of L-glutamine, zinc, microbiome diversity. There's your probiotics, your prebiotics, your fibrous vegetables. Improves microbiome diversity, and avoiding processed foods. Using vitamin D, vitamin A, and N-acetylcysteine, which again is the precursor to glutathione, also help strengthen barrier systems and mucous membranes. We have our second point, which was to strengthen your Th1 innate immune response, which can be done with echinacea, black seed oil, ginger root has double influence suppressing Th2, but also increasing Th1. Our mushrooms that we just talked about, The use of ashwagandha and bacopa all help strengthen Th1 innate immune response. And then we want to focus on resolving the inflammatory load. And we do that with all the supplements we just talked about on the slide prior. Camu Camu, EGCG from green tea. Oh, I didn't talk about those. So let me go back a little bit. So EGCG, active ingredient in green tea. Ginger, we just talked about. What else do we have? Capsaicin, which is found in the red skin of bell peppers. We talked about resveratrol already. Omega-3 fish oils, very anti-inflammatory. So these are all those we can use to control and minimize this inflammatory load as the infection starts to run its second half of its course. Okay? So what can I do for you as a healthcare provider right now? Well, the biggest being evaluating your immune system. Typically, we do it through blood testing, right? In a blood test, we can measure all those inflammatory markers we talked about earlier. But given the situation right now, it's very difficult to find labs and phlebotomists who are doing blood draws. So this is kind of tied my hands. But we do have a next best option. Cyrex Labs is probably the most forefront leading labs in the world as far as testing immunity and immune system function. A couple years ago, they created this saliva collection test to evaluate basically exactly what it says, mucosal immune reactivity. So this is a great place to start to evaluate immune system function and the strength of your mucous membranes and your epithelial tissues. This is a kit that gets mailed to your home. You collect saliva, you mail it back to the lab, and they send me results in about 10 days. Right? So that's a great thing to do right off the bat. Once things settle down and you're interested in getting your inflammatory markers checked, that we run as well. That's our baseline blood test, checking inflammatory markers. The other thing we can do in conjunction with this saliva mucus immune reactivity screen is we have a set of questionnaires that we have people fill out that also help me find out what your baseline levels of inflammation are, what systems of your body may be getting affected the most from inflammation, and how we can put a program together for you to address that and improve that. Okay. The other thing I can do as a healthcare provider for all of you is basically provide you with a list, basically all these supplements we just talked about. Many of them zinc especially is very hard to find at the stores right now because they sold out so fast. But I have my suppliers. My suppliers only sell to licensed healthcare providers, so they still have plenty of stock. This immune support packet is the perfect no-brainer you can do. It basically, they are medipacks. Each medipack by itself has 5 capsules in it. You take 1 packet a day, and it has everything you need. It has echinacea, it has your mushrooms, it has your N-acetyl-L-cysteine, which is your glutathione precursor. It has vitamin D, vitamin A, vitamin K, vitamin E. It has your quercetin, it has your vitamin C, and it has your B vitamins. Almost everything we just talked about previously, all in one easy packet. Okay. The other thing we have access to is essentially, to be more specific, we can support the Th1 immune response and the innate immune response with supplements that are essentially called that, Th1 support. And you can see that what's in there, basically a lot of the stuff we already talked about, plus different ones that we didn't talk about. And we have innate immune supporters. Same idea. You have your mushrooms in here. You have your astragalus, other things that we talked about or didn't talk about because we didn't have time, right? So I still have access to all of these, and they're still in stock. So those of you who want to be more proactive about these, you can be. Now, the one big thing I didn't talk about was dosages, right? Dosages for these supplements. Dosages vary from person to person based on what your immune status is when we start, whether you have autoimmune disease or not, and your age. Okay. So I'm not going to talk about dosages for liability purposes. We can have a conversation. Remember, I'm going to offer you guys a free 30-minute immune consultation. We can talk about a little bit what your baseline inflammatory levels are and what your immune status is. And we can talk a little bit more about possible dosages for you or for the family or for your kids. Okay. So remember this number again. If you're interested in this free 30-minute consultation to talk about your immune system or any other health related issue you might have, you can text the word immune, IMMUNE, to 408-752-5453. And that'll gain you access to my calendar so you can schedule your own appointment, and we'll meet through a virtual chat on there. Okay. All right. So that's all I have. Let me review the questions for those of you who had questions. Someone's asking for a copy of my presentation. Sure, I can give you a copy of my presentation. If you send me an email to the email provided here at the bottom, I can send that to you. We talked about black seed oil. We talked about camu camu. We didn't talk about moringa. I didn't look into the moringa, but I'm sure it has probably the similar effects as camu camu, which is another South American root. Anybody else have any questions? They can post them now. We have somebody asking about flu shots. So there was some controversial information going around about people should get their flu shot to decrease your risk when you do get COVID-19, right? That's often something that's pushed by the CDC. Now, I did a little bit of research on it, and it turns out vaccines actually increase your Th2 immune response. And remember, when Th2 immune responses go up, they suppress your Th1 immune response. So there was also some information after that coming out that no, you shouldn't get your flu vaccine at this time because you could potentially put you at higher risk for COVID-19. Based on the research I read, like I said, vaccines increase your Th2 immune response, which suppress your Th1 response, which in theory would put you more susceptible to getting infection and spreading virus locally because your innate Th1 response is suppressed. All right. All right. No more questions, it looks like. Thank you very much, guys, for joining me. I hope you found this beneficial and useful. Remember, if you're interested in the free 30-minute consultation, send a text to this number, 408-752-5453. That'll gain you access to my schedule. You can schedule your free consultation there. We'll get you some assessment forms. And once we speak and you're interested in knowing about either dosages or getting access to these supplements that I talked about that I have, we can discuss that then. All right. All right. Thank you very much. Be safe, stay healthy, and we'll see you next time.